Hello everybody, welcome to another presentation of the life-changing work that we carry out here at London Dental Specialists on a routine basis. If you like our videos, please subscribe to our YouTube channel and follow us at London Dental Specialists on Instagram and Facebook. So, let's get into today's presentation. It's a tale of two patients. I really want to give you an overall picture of my thought process when it comes to cosmetic dentistry. So let's get into it. One patient was in the mid-20s and the other patient in the mid-40s. I have noticed, and it's not just me, my colleagues have noticed, that the demand for cosmetic dentistry has skyrocketed, especially since COVID, probably because of Zoom, and also the fact that lots of us follow celebrities who are having these kind of treatments in Hollywood. In my view, everybody deserves to have a beautiful, beautiful smile. But it's important that I explain to you how to achieve that beautiful smile without paying a huge biological price. It is possible to have a biologically healthy, beautiful smile. Let's have a look. The picture on the left side is of my patient in her mid-20s at the end of treatment. She's smiling, her upper and lower teeth look absolutely amazing. This is a patient in her mid-40s and smiling. She is not happy at all. She's been to another practice who had done 20 crowns, 10 in the upper, 10 in the lower on her. And if you just compare both of them, picture on the right side, the teeth look separate. They look like individual teeth. Whereas on the right side of the screen, it looks like essentially like a monoblock of teeth that you would see in cartoons, for example. This picture here was taken before I placed the veneers that you can see on this particular patient here. And this picture here was taken after I took these crowns off, the crowns of the lady in her mid-40s. Why did I take them off, you ask? She was complaining that she did not like the appearance, but also the fact that no matter what she did, no matter how well she cleaned, her gums would bleed and had been bleeding profusely. On the left side, you can see that the teeth still look like teeth. They are white. Okay? They're white because those teeth in view still have enamel. On the left, the teeth look yellow because the enamel has been completely removed to place these crowns. And dentin looks yellow, that is why teeth are yellow. Now, why am I making the distinction between enamel and dentin? Enamel is crucial, ladies and gentlemen. It is the natural barrier against infection that nature puts there. And in my view, if nature put it there, people like me should leave it well alone because it is the most effective barrier to infection on the teeth. And that's why, in my view, that smile is biologically unhealthy because the enamel has been completely removed. So, on the left side, because I was essentially preparing teeth with enamel for veneers, I didn't need to give any injections. No injections whatsoever. And this picture was taken after the drilling was completed. You can barely see on those pictures that the teeth have been touched. Whereas, on the right side, because of the amount of drilling done by my colleagues in the other practice, I had to give lots and lots of injections because the nerves in those teeth were just really sensitive. On the left side, you can see the veneers, and I would expect those veneers to last 10 to 20 years, whereas on the right side, because of the bleeding and dissatisfaction with the cosmetic result, they only really lasted 2 years. So, bearing in mind where we ended up, this is where the young lady started from, the young lady in her 20s. Teeth completely in the wrong place. You can barely see the lower teeth. So when you have a situation where your teeth are in the wrong place with a bite like that, or the teeth are all completely bunched up, and you're not happy with your smile, the first step is to get those teeth into the right place with braces. And this is ultimately what she had. She had braces for about 18 months. But some people don't like the metal brace because of how it looks. You can have the cosmetic brace, the ceramic brace, much like what I have right now, which is barely visible. You can also have a brace that fits on the inside of your mouth, which is completely invisible. And the people who have this kind of brace that fits on the inside of the mouth are the ones that cannot have the clear aligners. And the reason why they cannot have the clear aligners is because they don't trust themselves to remember to wear the aligners for 22 hours a day. And you can see those aligners are removable. Although the lingual brace, the one that fits on the inside, works and works very well, the thing that I always warn patients about is around speech. Because it is so much closer to the tongue, it affects the speech more than the kind of brace that I have or the clear aligners. As we all know in life, there are choices and trade-offs, but it is really, really important that if you are going to have a beautiful, biologically acceptable smile, then you choose one of these options so that we can get your teeth into the right place and not have to strip off so much enamel. At the end of orthodontic treatment, this is what this young lady's teeth look like. You can now see the upper and the lower teeth together. The problem that she had first were the big gaps in the teeth. And the thing that I noticed was that the gums in the upper jaw in particular were just all over the place, in the wrong place, again, because of the appearance or the alignment of her teeth. So, remember, this is where she started. This is what her smile looked like after the orthodontic treatment. She did not like the gaps, remember what I said? And then this is ultimately really where she ended up. Beautiful, beautiful smile that she was ecstatic with. But if you compare this picture on the lower left and this picture on the upper right, you can see that the gums on the lower right are all more even in terms of the level, whereas in this picture, the gums are a bit all over the place. And you have to get the gums to the right level for the smile to look beautiful. So, teeth to the right place, gums to the right place, and then you create beautiful teeth. So if we then go back to my patient in her mid-40s, this is the way her teeth look at the end of treatment. Look at how she looked at the start. Massive change. You now have crowns that look like normal teeth. You also have crowns that she could clean beautifully, and there was absolutely no bleeding. Remember where she started. And this is ultimately why I wanted to make this video. That if you don't take the right steps, teeth in the right place, gums in the right place, you're going to run into problems down the line, and you're going to end up with some variation of teeth that look like that if we try and rush the treatment. The previous young lady in her early 20s, her treatment took 2 years. This patient, who was originally treated over a 3-month period from start to finish, that ended up with the way she presented to me, so the picture on the top right. Her treatment actually took 2.5 years to get from the start to the finish, for various reasons. One, I had to make sure that the crowns fitted perfectly. Remember I was saying that we had to get the gums to the right place. If you compare the gums there, they're all over the place. And in her situation, I had to do a gum graft to harmonize the position of the gums before the final crowns are placed. This is a lady in her mid-20s. Both of them have had beautiful results, but underneath, which is really what's important, underneath, if you do things properly, orthodontic treatment, gum position assessment, and then veneers, you will end up with very little contact on the teeth. But if you try and rush things over a very short period of time, you will end up with teeth that are either like that or a variation of it. Everybody deserves a beautiful smile, because it's the smile that we all notice first when we meet each other socially. But what if that smile could also be healthy? To get that, everybody needs to start with orthodontic alignment, and then crown lengthening surgery, which is what my lady in her mid-20s had, or gum graft, which is what my lady in her mid-40s had to have. Get the gums in the right position first, and then beautiful teeth that end up looking like either the picture on the left or the picture on the right. But to make sure that you have the best result in the long term, it is important that the teeth underneath have not been essentially drilled clearly to the extent on the TV, on the picture in the lower right. I've given you the bird's eye view of why, at least at London Dental Specialists, we sequence our cosmetic dentistry procedures in the way I have just described. There will be follow-on videos that describe these treatments in a bit more detail, but I thought that I should explain the rationale first before diving into the detail in other videos. So subscribe to the channel so that you can be alerted when these videos are published. As you can see, you can get a beautiful result. So don't suffer in silence. Pick up the phone and my team are here and waiting to hear from you. Thank you very much.